Let's take the repeal of the individual mandate, call repeal done. Let's get on with the work that we really need to do, which is at Premier really figuring out how to get to value-based care. So the view is, I don't know how many more or less uninsured there will be, but what we do know is people will end up in healthcare systems for their healthcare needs. So we need to get this to a value-based business model, and I think that the Congress can now move on to get that work done.
By doing what exactly? What would be their next step in order to shift the incentive structures that happen right now within the healthcare system?
Yeah, two big next steps. One is that the Murray-Alexander bill, which should come back in January to help stabilize the exchanges, we've got to do something to stop these 30–40% premium hikes. The second thing is, and many of these were Republican ideas, we have to push forward all of these value-based alternative payment models, meaning healthcare systems and physicians get paid or get penalized based on their quality, based on their safety, based on their cost. And they have the ability from a regulatory perspective and a legislative perspective to keep moving all of that forward.
Susan, how do you keep drug prices down? I mean, that is a major point of friction in the system here. In Premier's drug portfolio, prices have held constant at 4.55% a year, and that's well below the inflation rate of 10%. How does that happen? I mean, I am assuming that the people in the system who you interface with, they're using all the same sorts of drugs that everybody else is using.
Yeah, so Premier has done a really nice job of trying to reduce the cost of drugs. It's a very big challenge. The only thing that fixes it is creating competitive friction. We have a new FDA leader. Dr. Gottlieb has done a tremendous amount of work getting more generics through the approval process and stopping some of the delay tactics to getting new suppliers and new drugs into the system. Because at the end of the day, what Premier does is try to create that competitive friction between and among suppliers. When we have enough suppliers, we can create that friction. When we don't have enough suppliers, it's harder to create that friction.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.